This month, on a virtual view, we're focusing on something that might not have the most obvious connection to telehealth: tobacco cessation. Quitting smoking, after all, seems to be a largely personal choice. And what does that have to do with digital health? Well, it turns out it's more than you think. We're lucky enough to be joined by two experts in the field who have spent years working to help all sorts of people quit. And for the Great American Smokeout of 2025, they're going to help me, and hopefully all of you, understand why quitting matters and how, for some people, digital health tools can make all the difference. My first question to both of our experts was, what exactly is the Great American Smokeout?
Yes, for almost 50 years, the American Cancer Society has hosted the Great American Smokeout.
That's Andrea Radford from the American Cancer Society, where she's the senior program manager for tobacco control. She's a wealth of knowledge about the negative impacts that tobacco use has and about the benefits of quitting.
This is always on the third Thursday of November. So this year it will be November 20th. And the Great American Smokeout is an opportunity for people to commit to a healthy lifestyle, commit to a smoke free life, and not just for one day, but year round. The Great American Smokeout also provides an opportunity for individuals, community groups, businesses, healthcare providers, and others to encourage people to make a plan to quit or to initiate a smoking cessation plan on the day of the event.
I also asked our other guest, Natalie Rivich, the Director of Health Systems Change and Cessation Services at the Indiana Department of Health. She echoed many of the same points as Andrea, but she had also heard some interesting things about how the Great American Smokeout got started.
I think it was started by a radio DJ who took that call to action and did a big promotion around it, and the thought was, if you can quit for one day, you can start your journey and quit for life. It's just been a really good day of awareness for people, and again, a reason for people to take action on that day in their tobacco use. And so the Great American Smokeout has been led by the American Cancer Society for, like I said, I think since the late 70s. Long time.
And why is it important that that's like a large scale national event? Like, what use does that have?
So, this event is very important because tobacco use remains the most preventable cause of cancer in the United States. In 2022, there were 49 million adults that are used a commercial tobacco product. Cigarette smoking increases the risk of at least 12 cancers. And in the United States, cigarette smoking causes about 3 of every 10 cancer deaths. So, tobacco use is remains the most preventable cause of cancer. So since we have some modifiable risk factors, and tobacco use is one of them. So it's important that we take this time and set this day as the Great American Smokeout so that we can encourage members of our family, and healthcare providers can encourage their patients to quit and understand that there are benefits to them quitting.
hmm So, are there any specific messages or goals behind this year's Great American Smokeout campaign?
Yes, we always stress that it's never too late to quit using tobacco. No matter how old you are or how long you've been smoking, quitting improves some aspects of your health. And the sooner you quit, the more you can reduce your chances of getting cancer or other diseases. So we always want to stress it's never too late to quit using tobacco.
Natalie and I also discussed how the Great American Smokeout is often a starting point to quitting, not the last time.
Because we know it takes people multiple times for them to quit their tobacco use. I think the average is around 30 at this point. I mean, dependent on what kind of tobacco products you use, if you have any other underlying health conditions, behavioral health conditions, et cetera, it can be
hmm
more difficult for people to quit. So it's not really realistic, in my opinion, for people to quit in one day cold turkey. That's really not what we say is the best way for people to quit their tobacco use. So that's the
Right.
biggest difference I've seen over years with the Great American Smokeout is it's really focusing now on getting ready, using that day as a day to plan, start your journey, take action, and and really set your quit date for the American Smokeout Day and put a plan in place to get started.
One thing that both of my experts emphasized during our talks is that quitting is going to look different for every person. There's a lot of reasons for it, but one of the main ones are different barriers that face different people and different communities.
So there are some groups that smoke more heavily than others. And there are also some groups that may need more support than others. And so when we're looking at those that tend to have a higher use and also have to face more barriers, we're looking at people that are in a lower socioeconomic status, people that live in the rural communities, sometimes LGBTQ communities, but also, as you said, mental health is also a factor. Tobacco use, the addiction is a mental and physical addiction. So when we find that people are trying to quit, we need to ensure that they're receiving mental help as well as physical help.
We know that persons with behavioral health conditions are more likely to use tobacco. In fact, it's 32% of persons with a behavioral health condition are tobacco users, compared
Wow.
to our nationally, it's 15% for general population. So it's
Mhm.
considerably more persons who are using tobacco. It really resonated with me. I heard a speaker who was a behavioral health professional talk about tobacco use and talk about how tobacco use wasn't necessarily included in their other substance use disorder treatment or behavioral
Right.
health condition treatment. But she said what she found with her patients is it wasn't that they weren't dying from their schizophrenia. They were dying from heart disease and lung disease from their tobacco use. So
Mhm.
it's really important that we focus on that work. So a person with a behavioral health condition, they also smoke more. They smoke two more packs per month than the typical tobacco user. So I always say that tobacco is kind of dose related. So the more they're smoking, the more likely they are to have complications and disease as a result from their tobacco use. They also face challenges when they try to quit, such as a lot of times treatment facilities are not tobacco free, so they don't really offer a supportive environment. We
Mhm.
hear many times that their recovery specialists might be even taking smoke breaks with their clients, which again does not support them in a quit attempt.
Right.
Nearly 50% of the annual deaths from smoking occur among consumers with behavioral health conditions. So, like I said, they're really greatly impacted, and smoking exacerbates symptoms of behavioral health, greater depressive symptoms, greater likelihood of psychiatric hospitalization, increased suicide behavior. They have higher drug and alcohol relapse. So, it's really important for behavioral health professionals to include tobacco treatment when they offer the other treatment services. In fact, we know that there's a 25% more likely for a person with a behavioral health condition to to stay healthy, and those with a substance use disorder to not relapse if they have tobacco treatment included in their plan.
Right.
So,
So do you think that's an aspect, the behavioral health aspect, do you think that's frequently overlooked when we're talking about quitting?
yes, we have two things that help support this work. One is through Quit Now Indiana. We have a special tailored program specifically for persons with a behavioral health condition
Mhm.
that offers additional support, and it's tailored to their needs. We also work with the Department of Mental Health and Addictions to offer grants. Many grants to behavioral health facilities and recovery residences to help train their clinicians on how to incorporate tobacco treatment into the work that they're doing. Um, we also just recently worked with the Department of Mental Health and Addictions to change some of the language they have with some of their contracted community-based mental health facilities so that they ensure that they do two things, that they offer a tobacco-free campus and that
Mhm.
they offer treatment for tobacco. So that's in the contract language from DMHA at this point, which is really good to support that work. I think for a long time we kind of separated tobacco out from other drugs,
Yeah.
and that did not that wasn't the best service for those clients.
Right, right. I think viewing it as a substance disorder that took a little time. Like
Yes, it is listed in DSM-5, which is the manual, if you will, of
Yeah.
that all the substance use disorder are listed in, and it really is. You have to recognize it as the number one substance use disorder that we face in this country,
Hmm.
is tobacco use.
I asked Andrea about her thoughts on why certain communities have higher rates of tobacco utilization, and she had this to say.
So, some of these communities have been heavily targeted by the tobacco industry, such as African American or Black communities and LGBTQ communities. So, as these groups have been targeted by the tobacco industry with ads and things of that nature, they tend to have a higher rate of utilizing tobacco.
Understanding that there are some communities that are more heavily targeted than others, I wanted to know if there were digital health or telehealth tools out there that were specific for communities that have higher tobacco utilization rates.
So let's talk about the telehealth and digital health services that are related to more of our behavioral health treatment. Is that something that you employ at all or have seen successfully employed for substance use disorder?
Yes, we offer the Quit line through it's called Quit Now Indiana, and
Hmm.
it's digital services. You can participate in both telephonic services, or it has a digital dashboard where you can participate in all your sessions online. We also have a text-based program to support persons who are trying to quit vaping as well. It's called Live Vape Free. It's for young adults.
Yeah.
All of those programs include uh, nicotine medication, so nicotine replacement therapy like patch and gum, to help people in their quit attempt. We know that having those counseling services, the behavioral support, along with the medication, is the best way to help people in their tobacco addiction.
So do you think that to that end, has telehealth really changed the way that providers are approaching providing support for smoking cessation?
Yes, because we used to say, you know, providers needed to uh, do the interventions themselves. But we know in a busy practice, it's not really realistic to expect that counseling piece to happen in a busy office. So
Right.
that's what the Quit Now Indiana Quit Line is so beneficial, is because it offers all those counseling supports and the medication support necessary to help that patient quit. So really, a provider can refer somebody to the Quit Line in 3 minutes or less. It really is just ask, advise, and refer, and that's really all they need to do. And then we take care of it from there with through Quitline counseling and through the digital support. We have this really great digital dashboard with milestones to help people, um, uh, reward them along the way, give them tips, and offer support. There's such things like the cost calculator so that they can look at some of the benefits of quitting, of how much money they're going to save, also improvement in health. You really start having rewards in ending your tobacco use almost immediately. You start to have better respiratory, your blood pressure changes. So many things just happen pretty quickly.
I wanted to know more about how tobacco cessation services were being tailored to different populations. Luckily, Natalie had a lot of information for me.
Yes, we have a several tailored populations. I've talked about our youth program. I've talked about our young adult program, um, behavioral health program. We also have a program specifically for persons who are pregnant,
Oh, okay.
because we know that um, it's challenging when you're you know when you're expecting to have a baby and you want to do the best thing that's for your health, but you're also addicted to these products. So
Hmm.
it's tailored to them. It's also can help that person in their quit attempt postpartum, which is really important, because that's when relapse tends to be really high for pregnant persons,
Right.
is
Yeah,
after they have the baby.
that makes
So
sense.
yeah, there's no medication offered with that program, although just like with the youth program, under the guidance of your physician, um, we we do recommend that people talk to their physician about nicotine replacement therapy and what dosage might be appropriate, and if it's appropriate for them to use while pregnant.
Okay. Yeah, that makes sense.
Yeah, and then we have one other program. It's 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 kind of can go in conjunction with any of our programs, whether it's the adult standard program or the behavioral health program or the pregnancy program, and that's the menthol enhancement program. Um, Really, the coaches who work on that program and the content that gets delivered digitally on that program really speak to the fact of those persons who use menthol products. Menthol is a flavoring. All the other flavorings have been removed from tobacco products, other than we still see it in vaping products.
Right.
But menthol is the number one flavor being used in tobacco products, and it's not been eliminated yet. So
Huh.
um, and what menthol does is it makes it easier for people to become addicted to the product. It masks the taste. Um, it also has that cooling effect, so people tend to inhale deeper. So they
Hmm.
also tend to have lung cancer in the lower lobes, which makes it more difficult for treatment for lung cancer. So it does make you at more higher risk for more likely to have complications and premature death if you use menthol products. And unfortunately, menthol products from the industry have been targeted to specific populations. We see the most menthol use among the LGBTQ population and the Black population. Um, and you can look back at the history of marketing from the tobacco industry and see very specifically how they've used menthol products specifically for those populations to um, get them hooked, get them addicted.
That's so interesting. And this is coming from somebody who had like a family member who heavily used menthol cigarettes. I did not realize that there was
Hmm.
such a difference there.
Yeah. And that's why we have this enhancement program, and the coaches are specifically trained on how to assist persons who are using menthol products, and then they also are educated on just that history of how the tobacco industry has manipulated those populations and targeted those populations with those more deadly products.
I wanted to know more about the specifics of the quit line and how they look different in each state. Andrea had some information for me.
Yes. So every state has a quit line, and you can find that by just dialing 1-800-QUIT now. When you contact the quit line, and providers can refer their patients to the quit line, or people can just initiate themselves and make that call. But when they do, they will find out what resources are available for them to help them quit. Um, there are resources that are available, such as nicotine replacement therapies. There's also counseling opportunities, and you can even text with a counselor. These are people that are specifically trained to help people quit. So 1-800-QUIT now is how you can reach the quit line.
Natalie and I discussed how the Indiana quit line has been diversifying to reach not only the populations we've already talked about, but young people as well, specifically those who struggle with vaping.
We know most youth do not use combustible cigarettes anymore, youth and young adults both. I think we've seen this epidemic grow over time. Vaping has really become much more popular among
Yeah.
young people. And a lot of the reason it's not perceived the same as tobacco, combustible
Yes.
tobacco. I think there was a misconception early on that it was somewhat safer, that it was just sort of this vapor um, and
Yeah.
really it's still nicotine. It's still dangerous. It's still highly addictive. In fact, I think the new devices that they have are so fancy. They have all these. They have games in them. They're
Right.
digital pieces. They have all these flavors as well that make it really popular and attractive to young people
Yeah.
to use vaping products. So.
Yeah, I'm 32, so I missed by just a little bit that initial push of vaping being like a healthy and non-addictive alternative to
Mhm.
cigarettes. But I saw that among folks who were just a bit younger than me and among like my younger siblings where they're like vaping's not bad for you. And I'm like, wait, this is a lot of misinformation that we're spreading here. Let's talk about this.
Yeah. Yeah, and we really, the products aren't that old, so we really don't have a lot of research on what kind of long-term damage that it might cause. We
Right.
know it's not just vapor, and we
Hmm.
know that these products are manufactured by the tobacco industry, and we just know that they have had a history of deception. I mean, that's why we had the master settlement agreement, and the states all settled with the tobacco industry because they were deceptive. They were trying to engage youth in using tobacco products. They were directly marketing and targeting young people. So their practices haven't changed, and we see that uh, the evolution of the vaping products continue to change. Like I said, now they're so digitized, and they have all these lights and um, games on them to keep that person more engaged. I think if
Right.
you know people who are use vaping products probably yourself,
I do.
and
Yeah.
you look at how much time they spend vaping, they can't be without it.
Hmm.
So we hear young people talk about waking up in the middle of the night needing to vape.
And
So
you said that that's more of a text-based service to help those folks.
yes, we have two different services. We have Live Vape Free, which is a text-based service, completely text-based it base.
So it's like mobile.
Yes, it's meant for their phone. It's meant for them to. There's games and quizzes and um, podcasts and all these different tools that are also are part of that program. There's also stories like of other teens who are quitting, talking about their quit attempt and quit vaping attempt, and share their successes and their barriers as well. So that's really kind of self-driven. The more they engage with the app, the more content they get. And it can kind of customize to the content that they want to get. We have the other program, which is Quit Now Indiana's uh, digital program, and so that's just completely online. It's totally digital. Um, they have the digital dashboard, and they have also these stories and quizzes and games. It's just a different platform. One's text based, one's digital.
I really like that there is that text-based platform because I think it's really well tailored to the population.
Mhm.
Because I mean, I'm a chatterbox, so I don't mind making phone calls, but I know most people, most millennials and younger, aren't big on like calling up a quit line. Like
Yeah,
using a text-based service would be so much easier.
yeah. Yeah, exactly. That's why we developed why that program was developed with our vendor who offers those services for us. Um, we just no young person is picking up the phone and calling the quit line.
No.
That's just not how it happens. So this shift has been a good shift for us to make. Uh, it's still hard to get young people to take the service up. They
Hmm.
We do a youth tobacco survey every year, and more and more youth want to quit their vaping, but and their tobacco use, but they they don't tend to go to use these services. They're really underutilized. They
Hmm.
often work with, peers, and they often try to quit cold turkey. And again, those aren't the best ways um, for people to quit using tobacco products. And even though youth are not approved for use of nicotine replacement therapy or medication through FDA, through the patch and gum, like they're not approved for people who are under 18.
Hmm.
But if you that doesn't mean that you can't go to your provider, your pediatrician, and talk to them about quitting. And under the guidance of your provider, you can get medication for even if you're under 18.
Resources can be limited in the tobacco cessation space, which is one of the reasons why Natalie thinks it's so important that we tailor programs to focus on those populations that are most at risk.
Yeah, and I think like when you look at a state like Indiana, we have a lot of rural areas that
Yes.
don't have providers, for example, that maybe can do this service easily, or maybe there's not as many resources. So that's where things like the quit line can really fill those voids because it's accessible and for everybody to use. And it doesn't matter if you have a provider who refers you or not. You can enlist in the services on your own, and it is a free service, completely free to anybody in the state who wants to um, make a quit attempt and is ready to quit. We're there to help. And we do
Yeah.
offer free medication, the nicotine replacement therapy, to those who qualify. So, like if you have commercial insurance and your insurance covers medication for that, we won't necessarily give you that medication.
Yeah.
Um, if you have military insurance that's covered under their military insurance benefits and too, so you won't give the medication. But if anyone else, if you're Medicaid member, for example, you would be able to qualify for uh, free medication.
Yeah, no, that's so good. And I do like that you mentioned the rural areas because as like a telehealth advocate here, my favorite thing about it, particularly because I work in a state with a lot of rural areas, is that able to provide this access to folks.
Hmm.
And that can be such a great way to overcome the main barrier that we have, which is access. There's just not providers there, there's not specialty services. So if we
Yeah.
have these things like the quit line, that's just such a great way to get folks connected.
Yeah, it really is. And it's important. I mean, you can access services even just on your phone through an app. So I know we
Hmm.
still struggle with gaps in like wireless service, for example, around the around in rural areas, for
Yeah.
example, in Indiana, that there are those issues and those barriers. But
Hmm.
it can be downloaded as an app on your phone, and you can participate that way too.
It's not always easy to integrate new services into a provider workflow. I wanted to know what Andrea and Natalie had to say about what advice they would give to providers who want to be better about helping folks quit smoking.
My advice would be to encourage your patients to make a quit plan and then give them a referral to the quit line. Referrals can be done through the electronic medical record or via fax. There are a lot of options for the quit line, and all of that information is on the website, the quit line website. But get your patients connected with the quit line. And as they do that, then the quit line staff will reach out to that client. So for providers, I would say make sure that you are referring your clients directly to the quit line. There are also other resources for quitting. The American Cancer Society has a program that is called Empowered to Quit. This is a email-based program. There's no cost to charge or anything to the patient. The patient enrolls in the program. They can do that online, and then they'll receive emails in their inbox to help them quit. And it's going to provide them with other tools and links. And links will be in the email for them to click on and learn about other resources to help them quit. So the Empowered to Quit program can go right alongside any other cessation resource that the patient is already using.
What I would recommend is that uh, one, you have to have a champion, right? So everything really rises and falls with leadership. So you need your leadership buy-in to prioritize tobacco treatment as something that you want to incorporate into your practice. And I don't see why there would be a reason not to. The barriers, I think, is really just time. And then another big barrier that we see with our health systems is just there's a lot of staff turnover. So having somebody who's going to champion that work in your practice or your clinic, and having strong leadership support are two things that are kind of what I see as essential for a health system or a clinic or a practice to really start doing this work. And then really, it's really not that hard. We have lots of tools and resources to train providers. If you go to the website, there's a whole tab that's geared towards providers. It has where they can use referral tools that we have. They can learn about Ask Advice Refer. Learn about motivational interviewing. We provide opportunities for them to learn those as well. We also have a statewide partner who does training, tobacco treatment specialist training, because what we do know is that a lot of times healthcare providers don't get a lot of education about tobacco treatment in
Right.
their education. So I think a lot of times they don't feel equipped to do that work. And the barrier of time. So
Right.
really it's asking, advising, and referring to the quit line. And we like to say do an active referral to the quit line. So don't just say, here's the number 1-800 quit now. It's better if you actually go to the portal and you refer that patient physically to the quit line. And then they're going to get a call from the quit line, or contacted from the quit line if they agree to text messaging within 24 to 48 hours. And then they can start planning their quit attempt, setting their quit date, getting their free medication for quitting, and setting up some time to talk with the counselor, or should do it digitally through their own um, dashboard. So it's really pretty easy. All the doctor's office needs to know, or the provider's office needs to know, is uh, the number 1-800 quit now, and how to refer a patient.
Right.
And that's really key, to have more and more physicians refer and talk about tobacco treatment with their patients, even if they just mention it at each and every visit. That's what the recommendation is that
Hmm.
you ask each patient at every visit about their tobacco use, and then advise them on how to quit or the benefits of quitting, and then make the referral to the quit line. So it's just those three easy steps, but it starts with the ask. And we know that the provider is a very trusted source for any patient. And the likelihood that they're going to make a quit attempt is 50% greater if their provider encourages them to quit. So it's really important that providers ask the question.
So you've decided to quit and you've picked the Great American Smokeout as your quit date. What now? Well, I asked Andrea and Natalie, and they both had some good advice.
So, when a person is preparing to quit, one of the things that they can do is identify the resources in their area. They can look for are there support groups in their area? What does their insurance cover in regards to prescription medication? Where and how can they access tobacco nicotine replacement therapies, and be familiar with what is available through the quit line. So knowing what the resources are will help them as they start this journey. Then they identify when they want to quit, or what we call picking a quit day. So once they identify that this is a day, and maybe it's going to be on the Great American Smokeout. Sometimes people do it actually on that day. And then they decide, okay, this is going to be my quit date. And they make sure that they're enrolled in some type of counseling program, or they've already made contact with the quit line. They have purchased their nicotine replacement therapies, picked up their prescription if they're using prescription medications. But have those resources ready and available to use on your quit day.
So if you're gearing up for the Great American Smokeout, and that's going to be your quit date, right? So that's important to have your quit date set. That's the one of the key things. But how do you get ready for that? Well, one, you want to build some support around that. You want to tell people that you're going to make a quit attempt so that they'll support you. Um, you also want to have a plan in place. So what are you going to do? Relapse is very highly likely, and even if you do relapse, I would tell people that doesn't mean that you have to just go back to using tobacco products. That relapse happens in substance use disorder. It's very common. So how are you going to deal with those triggers? You can deep breathe. I know that sounds so very simple, but deep breathing, delaying. So if you have an urge to smoke or use tobacco products, just taking a 5-minute delay. Sometimes you can then get over that craving at that time. You want to drink lots and lots of water. That's really important too. And sometimes you want to, I know this is probably a more difficult one, but sometimes you want to make some changes in your life, even if they're small changes. So it's so funny because like the triggers, when I was working with people doing cessation classes, for example, they would talk about how, they can't, getting in their car is just automatically they light up their cigarette or vape or whatever when they get in their car. It's just part of that whole mindset. So you have to kind of prepare for those. So maybe you want to change your drive to work, maybe just a little bit. Just those small changes really impact your ability to be successful. And having a strong network of support is important too. And I would really encourage everybody who's making a quit attempt to talk to their healthcare provider about it. Because even though you can get the medication from the quit line for free, um, you can ask your physician if they can give you more, because it's you really do need more than 2 weeks. The recommendation is really 12, but we only give like a starter kit from the quit line. So really talking to your healthcare provider is important. And they can also prescribe medications that we don't provide through Quitline services. We give like patch or gum, but if you have, say, oral, maybe you have dentures or maybe you have loose teeth or TMJ, you might want to ask your provider about getting the lozenge just because that's going to be easier for you to use than the gum. And really, combo therapy is really beneficial too. So we know with the medication, if you put the patch on, it takes a little while before that gets absorbed in the skin. So we recommend putting the gum in first, putting the patch on, and then using the gum as well, because that will also release more quickly into your system until that nicotine patch kicks in. So that's important. So those are some of the things you can do. Tell everybody you know that you're making a quit attempt. Do the 4 Ds, which is drink, delay, deep breathe, or do something. Sometimes it's just go for a walk, right? Um, and then making sure that you have plans for when you have these relapses or when you have these triggers. I also recommend, which I thought was really highly effective for the persons I was working with, is to do like a reason card and keep that with you all the time so that you can pull that out. And usually the people's reasons for quitting their tobacco use is usually related to their family. Like maybe it's someone they love, or maybe it's to honor someone that they lost from tobacco use. I talked about my parents. So, that's a real motivator when you connect it to things that are important in your life. I had one behavioral health specialist who was working with us on a grant for the tobacco-free recovery work that we do. She said it's really just finding their currency. What's the currency for that particular person? And then making sure that they remind themselves of why they're doing this. And it could be family, it could be money, could be your own personal health. So find your reasons.
No, that's awesome. And that's such a good way to contextualize it. Finding someone's currency, the reason that they're quitting. I love that.
Yeah.
Quitting isn't easy, but the resources are out there, and events like the Great American Smokeout can help folks get connected with those resources. Before we ended our conversation, I asked Natalie about her drive to keep doing this work, and she had this to say.
Yes. When you're passionate about something, you keep at it. And so it's just something that I'm really passionate about. And honestly, tobacco touches so many of our lives, and both of my parents were affected by their tobacco use, and died
Mhm.
from tobacco-related illness. So it does drive my passion quite a bit, and it makes me really feel good about the work I'm doing with helping people quit their tobacco use.
Thanks for listening to this episode of A Virtual View. Thanks to our guests, Andrea Radford and Natalie Rivich, for their time and expertise. For more information about the Great American Smokeout, you can view the resources in the description of this episode. If you enjoyed this episode, you can comment, like, and subscribe. We'll talk to you again soon.
Thank you for listening to A Virtual View. You can find more information about today's episode in the show notes below. If you would like to support our podcast, please rate and review us on your favorite podcast platform. Do you have any questions or topics you'd like us to discuss? If so, contact us at info@umtrc.org or through the form found in the show notes. Also, we'd like to give a special thanks to our editor, Tristan Yoder. Finally, a special thanks to the Health Resources and Service Administration, also known as HRSA. Our podcast series, A Virtual View, is sponsored in part by HRSA's Telehealth Resource Center program, which is under HRSA's Office of the Administrator and the Office for the Advancement of Telehealth. The content and conclusions of this podcast are those of the UMTRC and should not be construed as the official policy of or the position of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Thanks for listening and have a great day.